Assalamualaikum and very good day. So today our group will be discussing a case report for a binocular vision clinic patient. I'm Nur Isma Farisa Menturesmi 1611460. So patient was a 31 years old female, worked as an administrative officer in IIUM Kuantan. She came and had a complaint of blurry vision for both eyes at near after looking for 15 minutes work since 1 week ago. She had to reduce the work or stop doing them to help relieve symptoms. She also complained of feeling intermittent greenness and eye redness. She was a full-time spectacles wearer since she was 8 years old, and her current spectacles were 3 months ago, bought from IIM Optometry Clinic. On the other hand, she had no any other complaints of headache, flashes, or even flutters.
Assalamualaikum, I am Ahmad Amaluddin Anwar. Okay, let's proceed to the second part of subjective refraction. Patient is generally healthy, but she had been taking a drug named Diane for progesterone and estrogen, but it stopped the medication since 1 month ago. For birth history, she is a premature baby. Family's ocular and medical history are unremarkable. Work performance, she claimed that the symptoms affecting work efficiency since she needs to limit or reduce her near work. Thank you.
My name is Ramsulah binti Muzi, metric number 1618232. I'll proceed with objective assessment. For her aided vision at distance on the right eye, she got 6 minus 2, and pinhole is no improvement, while the near VA is N5 at 40 cm, and for distance aided vision on left eye, she got 612 minus 1. For pinhole, she got 612 plus 2, while her near vision is N6 at 40 cm. Computed accommodation AA on right eye is 11/9 for all 3 reading, and for left eye, patient cannot see target clearly although we're using N12. Her expected AA is 8.5 diopter plus minus 2, and then we continue with NPC. She got 16/18 for all 3 reading, which is abnormal. For dot, show no suppression at distance, and for steropsis, we're using TNO for near assessment and got 240 second art. For distance, we're using Sterofly random dot test and got 60 second art.
For the objective findings, the Hirschberg cover test is done following the removal of the spectacles, and the result shows the left eye cornea reflex displays 15 degree nasally for both distance and near. And this is supported by the cover test findings, which shows the left eye constant exotropia at distance and near. So we decided to proceed with Krimsky test and prism cover test to measure the ocular deviation of the left eye. So basically, the Krimsky test is a method of approximately measuring the deviation with prisms. Corneal reflection is the reference for measuring the deviation. The corneal reflection is asymmetrical, and the prism is used to measure the corneal reflections in one eye to make it symmetrical to the other eye. Meanwhile, for the prism cover test is a method of approximately measuring the ocular deviation size with cover test using the prism. Alternate cover test is performed until there is no recovery movement of the covered eye. This gives us the amount of the deviation in prism diopter. So in this case, prism of increasing strength with apex towards the deviation, which we use base in, is placed in front of the left eye, and occluder is placed in front of the right eye, and proceed with the cover uncover test until there is no movement detected on the left eye.
For subjective refraction, we found that this patient has minus 650, minus 150, axis 180, with VA 66 minus 2 on the right eye, whilst on the left eye, patient has minus 7, minus 175, axis 10, with VA 612 minus 2 on the left eye. So this patient has high compound myopia with astigmatism on both eyes, but we also suspected the left eye with amblyopia due to the reduction in visual acuity. So moving on to MEM findings. So on the right eye and left eye, the MEM is about the same. So difference with plus 0.25, plus 125 diopter in the right eye and plus 150 diopter on the left eye. But it still shows a little bit lack of accommodation on both eyes. And moving on with AA, amplitude of accommodation. So as from her expected AA, it should be about 8 diopter plus minus 2 diopter. Hence, on the right eye, it shows a little bit high AA, 11 break and 9 recovery. And for the left eye, it shows about normal within normal limit AA as expected to her age, which is 8 break and 6 diopter recovery. However, we can observe that there is imbalance of accommodation between both eyes due to the difference on the amplitude of accommodation on both eyes. Okay, upon performing cover test, we found that at distant and near on the left eye there is constant exotropia. So to find the magnitude, we perform cream slit test. So on at the distant, we found that there is 8 prism base in, okay, and also at near 6 prism base in. So it's about the same at distant and near, the magnitude of exotropia. Hence, because there is exotropia, we also perform eccentric fixation testing to find that to conclude if this patient has eccentric fixation or not. So we performing eccentric fixation by using two tests, pass pointing finger test and also ND filter. So fortunately, on the right eye there is no EF, because we can see that the right eye is the good eye, while the EF we found on the left eye, which could be the amblyopic eye, and also because there is XT on the left eye, it could be due to the strabismic also. And we found that there is EF on the left eye. Okay, so using pass pointing finger test, it shows that when we shut the good eye and we use the amblyopic or strabismic eye, which is the left eye, and we ask the patient to hold the pen at about 25 centimeter in front of her eye. So she need to touch the tip of the pen, so it goes a little bit sideways, then at the center of the pen. So it suggests that maybe there is a bit of eccentric fixation and the patient cannot touch the tip of the pen as it should be. And also we confirm with ND filter, so it should be with ND filter with increasing density of the filter. It should be that the VA will be reduced, but if there is eccentric fixation, usually the VA is still good. So there is presence of eccentric fixation on the left eye.
For the pass pointing finger to detect the appearance of the eccentric fixation, basically the localization of object in space has been disturbed in amblyopic case. So the procedure of the pass pointing finger, first we tried on the good eye, in this case is right eye, and the bad left eye is covered. So the patient is asked to place a finger on the forehead just above the right eye. The left index finger is held at a distance of 25 cm, and the patient will move the right index finger to touch the left index finger. So this patient is allowed to practice if there is any difficulty. So next occlude the good eye and repeat the step. If the fingers goes a few cm to one side, pass pointing finger is demonstrated. Meanwhile, for the ND filter, if VA does not reduce when ND filter is placed before the eye, most likely the eccentric fixation is present.
So for the entry assessment, these are the findings that we found remarkable during this visit. So as we performed Van Herrick, we found that this patient has shallow Van Herrick due to the grade to grading on both nasal and temporal part on both eyes. So we need to confirm the anterior chamber depth, so we perform Smith method. It should be for normal, it's about at least about 2 mm, but in this patient we found that the Smith method only about 1.8 mm, which is a bit concern for us because she might have angle closure. So we also double confirm with gonioscopy to make sure that either the anterior chamber angle is closed or not. So upon doing gonioscopy, we found that on the right eye, at the inferior and also at the superior, it is graded with grade 3, which means that it's quite open. And for grade 2, at the nasal and temporal part, which confirms our Van Herrick, it is a bit close on the nasal and temporal part of the right eye. For the left eye, at the superior and nasal angle, it is open, widely open with grade 4. However, we found that it is really close at the nasal and temporal part of the left eye, which we graded with grade 1. So we are using Schaeffer grading to grade the gonioscopy findings. So it is really a concern for us because if we need to dilate this patient or we need to put any dilating agents, because we cannot just do it recklessly because this patient has possibility of angle closure and we need to thoroughly perform this assessment to confirm either it is safe to dilate this patient or not.
Assalamualaikum warahmatullahi wabarakatuh. I'm Fasiha Anis, metric number 1611114. Okay, so this is our final diagnosis. Based on the subjective reflection, the patient is diagnosed as both eyes compound myopic astigmatism, as the refractive error on her right eye is -650, seal -150 and axis 180, while for her left eye is -7, seal -2 and axis 10. And then second is left eye strabismic amblyopia. Okay, strabismic amblyopia results from neural changes in the diabetic eye or visual pathway in strabismus. Since the patient has left eye constant XT, so she is diagnosed as strabismic amblyopia. And her best corrected VA on her left eye is 6 strab -2. Okay, third is left eye constant XT at distance and near based on the cover test finding. This is also proven by the Hirschberg test finding in which both corneal reflex at distance and near was displaced approximately 15 prism diopter nasally. Okay, lastly, the diagnosis is left eye eccentric fixation. This is confirmed by using two tests which are fast pointing finger test and ND filter test. Both indicates that patient has eccentric fixation. Also, eccentric fixation occurs commonly in strabismic amblyopia.
Lastly, we go for the management. So this patient is advised to continue her current glasses since there is no significant changes in the new RX compared to the current glasses. And then eccentric fixation therapy was also prescribed to this patient. She was asked to occlude her right eye while wearing the right filter lens on the left eye and do nail work at 40 cm for 30 minutes every day. The aim of this therapy is to desensitize the eccentric fixation. And then this patient was asked to come again in 6 weeks to review her visual acuity, refraction, ocular deviation, and eccentric fixation.